Hi, I'm Ali Mackay, psychologist and director of Due North Psychology based in Miranda. This short video is just for your information if you're a doctor or a specialist who often refers patients to see a psychologist and then finds out that the patient didn't make the follow-up phone call. There's just a couple of obstacles that we might be able to troubleshoot, and here's some ideas in this video. Common misunderstandings are that the patient doesn't understand the role of a psychologist and may not know exactly what to expect from therapy. We do have some other videos on our channel that maybe we can direct them to help them to understand the role of a psychologist in their physical health recovery. We find that it helps if they take a moment during the visit with you. If you do suspect that a psychologist could be of great benefit to their mental and physical health, to just describe how psychological services might be useful in concrete terms, such as psychologists can assist with sleep and insomnia by providing concrete strategies that are proven in clinical research to be very effective without any use of medication. Psychologists are very good at allowing a patient to speak their truth at the same time as encouraging them to move towards a life pattern or a new habit that will be greatly beneficial for them without forcing. Sometimes patients are concerned about finances, and it's always expensive to see a specialist of any sort or a healthcare provider, and we do understand that. However, it might be helpful to provide affordable options such as the Better Access scheme through Medicare, for which they simply need to let their doctor, their GP, know that they wish to see a psychologist, and then they can have a large amount of that fee rebated to them through the government for 10 sessions in a calendar year. They may also have private health funds that go a fair way to supporting them to having a couple of sessions, which could be enough to get them on the way. We don't want to make it be onerous for the patient or to be seen as a big obstacle because there's so much need for these people to get the right sort of support, and early intervention is so much more helpful than down the track when they've actually reached the point where they don't think they can cope anymore. Another obstacle is the stigma. Let's face it, until recently, nobody ever admitted to seeing a healthcare professional like a psychologist or a psychiatrist. And it's only recently become a little bit more mainstream to talk about that in general, say in your workplace or your family. And so just assisting the process, it can be helpful to say something like, many people find that psychological therapy is an excellent way to cope with stress and life changes. And let them know it doesn't have to be for long. They may have an image of the therapist's couch and, Sigmund Freud or a lot of medications or things like that. Just letting them know that psychologists are really here in the community. They're practical, they're grounded, they're people with families themselves, and they'll understand. Sometimes there is also a perceived lack of time to see a psychologist. These people are often going to many specialists as it is, and they're taking time away from other important activities like work or spending time with children or grandchildren. If they feel as though they don't have time to fit this into their busy schedule, they're unlikely to make the appointment. Again, just emphasising that even a small amount of therapy can lead to significant improvements in well-being, and that might encourage them to take the next step. Some people have a fear of change, meeting new people, or even a fear that they will have to face all of their difficult emotions or the skeletons in the closet. It can be very helpful to, again, encourage patients to think of therapy as a supportive and safe place to explore feelings if necessary, to help them to see their way past the things that get in the way of them being able to make the changes they want to make. And just letting them know that the psychologist is only there to meet their goals, not the psychologist's goals. I'd really encourage a collaborative approach. We love to collaborate with all of the referring doctors and specialists that we encounter along the way. We find that the patients feel really held and supported, and certainly that extra bit of communication to understand maybe an additional thing that might be going on for that person can be so helpful. A brief letter, a text even, or a quick note sent by email can be just enough. And for our preferred referrers, we set up a private WhatsApp group so you can connect with us directly and we can let you know if we have space for that person. So do reach out to our info@duenorthpsychology.com.au site, and we'll help you along the way for that as well. Thank you so much for your time, your continued partnership, and the best care of patients.